Hello and welcome to the channel. So in this part of the lecture, we will discuss about an intrauterine device which is called Mirena. That's the commercial name. Actually, that's the brand name. The actual component is a hormone that's called levonorgestrel, which is a kind of progesterone. That's a hormone. So it's actually it apparently it looks like a copper device and it goes into the uterus, but the main difference between a copper device and this Mirena, or it's actually called levonorgestrel intrauterine system, is it contains hormone progesterone. Okay, it does not contain estrogen. And so there are some main differences. It has many purposes. Unlike copper device, which is used only for contraception, Mirena is used, yes, for contraception, but it is used as a treatment for heavy menstrual bleeding as well. And it can also be used in for hormone replacement therapy to replace progesterone. Okay, so it is more expensive compared to a copper device. Okay, but the side effect profile it's slightly different, and some contraindications are slightly different. So we will talk about it. See, for copper device, we said that it depends on the amount of copper. So it can be used for 5 years, or in some countries it comes for 8 years or even 10 years. It depends on the amount of copper in the device. Mirena is always, if used as a contraception, for 5 years. If it is used as part of hormonal replacement therapy in menopause, it is used for 3 years. Okay, so but for contraception, it is used for 5 years. That's fixed. Okay, for contraception. Then it is used as a method of treatment. So if a woman needs contraception and at the same time she is having heavy menstrual bleeding and there is no problem inside the uterus, then we can offer her Mirena. And remember, theoretically, the first line treatment for heavy menstrual bleeding, if there is no problem inside the uterus, that's in levonorgestrel intrauterine system. Okay, and also copper device can cause dysmenorrhea, right, with heavy menstrual bleeding. So Mirena is effective for heavy menstrual bleeding treatment with if the patient has or has not dysmenorrhea. Okay, so yeah, for copper device, even I forgot to tell you that copper device should not be used for women have who are nulliparous, who do not have any children. Same applies to Mirena. And the reason is because they can cause pelvic inflammatory disease, okay, which can cause blockage of the fallopian tube. So Mirena is recommended for women who have had at least one child. Okay, so what are the contraindications? Some of them are same as for intrauterine device, which is if we suspect pregnancy where we cannot rule out pregnancy. Okay, if there is some problem in the shape of the uterus, congenital or acquired uterine anomaly, fibroids if they distort the uterine cavity, which means if there are submucosal fibroids, acute pelvic inflammatory disease or a history of pelvic inflammatory disease, okay, especially acute pelvic inflammatory disease, okay, or even recurrent history of pelvic inflammatory disease. Postpartum endometritis, so any infection in the uterus, especially in the last 3 months, okay, known, which is like recent or active, right? And known or suspected uterine or cervical neoplasia or unresolved abnormal cervical smear. So if we suspect any cancers either in the cervix or anywhere in the genital tract, if we cannot rule out what is the cause of abnormal bleeding, because it can again be an infection or a cancer. Untreated acute cervicitis or vaginitis, including bacterial vaginosis or other lower genital tract infections until infection is controlled. Acute liver disease or liver tumor, which can be either benign or malignant, like for example a hepatoma. A previously inserted IUD that has not been removed. So if there is previously, for example, one Mirena, of course we cannot put another Mirena, but what we can do, we can remove one Mirena and put this other at the same time. And again, if there is an IUCD copper device, remove that and replace it with Mirena at the same time. Okay. So hypersensitivity to any component of the product and known or suspected carcinoma of the breast, because remember it's progesterone. Now it is important to understand that Mirena mostly acts locally. Very little amounts go into systemic circulation, but still, okay. So, and these list of contraindications, I took them from the package of Mirena, okay. So this is recommended by the company which produces it. Now, what are the side effects? Some of them are almost the same as for copper device: pain or trauma to cervix during placement. It can come out, it can be displaced, and sometimes women don't even realize, and they can have pregnancy, and there is risk of ectopic pregnancy. We can perforate the uterus without knowing it. Especially remember, if we are using uterine sounds, actually we use mostly uterine sounds, right? So we can perforate it. And then active pelvic, so it can cause infection in the uterus. Okay, but compared to copper device is more notorious to cause pelvic inflammatory disease compared to Mirena. Irregular vaginal bleeding, especially in first 3 to 6 months, and amenorrhea. So 20% of women, they will notice that their periods have stopped. So what is the main mechanism of action of Mirena? Okay, so it is placed in the uterus. It causes endometrial atrophy. It shrinks the endometrium. Okay, so remember, progesterone is the treatment for endometrial hyperplasia, right? Because it shrinks the endometrium. So same, Mirena is a progesterone, so it shrinks the endometrium. That's its main mechanism of action. Okay. So what are the benefits of Mirena over intrauterine copper device? Mirena is used to treat heavy menstrual bleeding, while copper device causes heavy menstrual bleeding. It can be used for hormonal replacement therapy, for replacement of progesterone. Okay, of course, it cannot replace estrogen. It can be used in dysmenorrhea, and cervical device causes dysmenorrhea. Okay, it's in itself not a treatment for dysmenorrhea, but especially with heavy menstrual bleeding, it can help. So again, the same thing applies. If a woman cannot feel the threads, like for copper device, we follow the same sequence. Okay, but remember that it does not has copper in it, right? So if it is lost, right? So what ultimately, if we think that it's in the abdomen, we have to like it. It may need either hysteroscopy or laparoscopy depending on where it is lost. Okay. Now, the next one is subdermal implant. Subdermal implant is very effective. It's one of the most, it is actually the most effective method of contraception. And it is said that its efficacy is equivalent to that of female sterilization. Okay. But remember that no contraceptive method is 100% effective, right? There are always failures, even if it's male sterilization, even that can fail. Now, subdermal implant, actually, it's kind of a rod that's almost 4 centimeters long rod, but it is filled with hormone. Okay. And even there are different types. Okay. Sometimes there is one rod, sometimes two rods need to be placed. They have different names. For example, Norplant is one of the famous ones. And then there are different brand names. But all of them, they contain progesterone. Remember, whenever there is progesterone given, it can cause irregular bleeding, especially in the first 3 to 6 months. So one of the known causes of Mirena even is having irregular bleeding in first 3 to 6 months. It does not mean that there is a pathology. It's just that it's a known side effect. Okay. So all kinds of progesterone, whether women take them orally or subdermally or intrauterine, they cause irregular bleeding. Okay. So the contraceptive implant is also the active component. Yes, it's a progesterone, but what kind of progesterone? It's etonorgestrel. Okay, it's not levonorgestrel. It's etonorgestrel. That's the name of the progesterone. It is 99.95% effective, and it's used for 3 years. So that if a woman says, I do not want any children for 3 years, this is a very good method. Even she can use even a copper device, because if it's for 5 years, right, it's more than 3 years. So she can use any method of LARC. Okay. So the contraceptive implant is a flexible plastic stick, 4 centimeter long. The implant slowly releases progesterone, prevents ovulation, and causes thickening of the cervical mucus. So progesterones, that even if it's taken as a tablet, they prevent ovulation, and another effect is they cause thickening of the cervical mucus. And how does it help? It makes it difficult for the sperm to travel. Okay. Now, again, except condoms, no method of contraception prevents against STIs. Sexually transmitted infections, they are only prevented by condoms. That's it. Okay. No pill, no device, nothing. Okay. So when the how it is inserted and when does it start to work? Okay. So, and what are the side effects? So, when the implant is first inserted into the arm, it can take up to 7 days to start working to prevent pregnancy. Okay, usually that's usually it takes some time. Okay, so what are the benefits? Periods may be less painful, acne can improve, because progesterones can be used during breastfeeding. It can be taken out at any time by a person. By the way, placing implanon is easier. Removing it may be difficult because sometimes the implanon can go deep into the muscle. Okay, and exactly where it is placed, actually it is you preferably placed in the non-dominant arm. Like if a person is right-handed, it should be placed in the left-handed, and it's almost 4 centimeter above the elbow. Okay, so it's just, and it can be felt after it's placed, it can be felt by the patient. Even they can feel that it's just felt under the skin. It should not go into the muscle. That's a side effect. Okay, that's a complication. So it can be felt, it's subdermal, okay, under the dermis. uh, so it can be taken out at any time, like a copper device or a Mirena. Once removed, fertility quickly returns. That's a big benefit. Okay, and it's the same for Mirena and IUCD. Fertility returns quickly. What are the side effects? Initially, there may be bruising. Okay, so and the patient may need a bandage after placement. A lot of people, they put a bandage. Okay, for 24 hours. Wearing a bandage over arm for 24 hours helps reduce bruising and tenderness. The patient may need ibuprofen, irregular vaginal bleeding because it's progesterone. Around 20% of women using the implant will have amenorrhea. Okay. And other side effects of progesterone, for example, now all progesterone, whatever route it is taken, especially if it goes into systemic circulation, it can cause breast tenderness, it can cause mood changes. So if someone is known to have depression, we have to be very careful while giving progesterone. Okay, it can cause weight gain. How weight gain? Because progesterones retain water, okay, in the body, and it can cause headaches. Okay, these are some known side effects. They can also cause nausea. Now, what are the contraindications? Of course, if the patient refuses, if the doctor or healthcare provider is not trained, if especially because it's a progesterone, so breast cancer, severe liver disease, retinal vein thrombosis, uncontrolled hypertension, history of cerebrovascular disease, history of stroke, history of DVT, and thrombophlebitis. These are the contraindications. Now, I do not expect you to remember all of them, but at least you should be able to remember 4 or 5 at least, right? So, yeah. And what is the best time to place implanon? That's actually soon after periods. Why? Because we are 100% sure that patient is not pregnant. Okay, because if we place it in the middle of the month, then she may be pregnant, right? And even if we do a beta HCG test, it may be negative despite she being pregnant. So rest of the devices I'm going to discuss in the next